Wait for the doctor. The doggy doctor.
Professor Noel Fitzpatrick
All right, Mrs. Cuddle Monster incoming.
is the Supervet.
We have issues.
I knew I should have got chihuahuas.
At his unique vet practice, he merges mechanics and biology.
Past the point of no return now. Don't be pulling apart my repair, missus.
To heal the nation's pets.
Sorry about coronavirus.
Oh, because you're responsible?
I'm responsible for almost everything else.
Even in the darkest days,
Worst thing ever.
Noel imagines the impossible.
Oh, my little baby girl's leg.
Let's go. Sometimes you have to bend the rules of mechanics to fit the biology.
And offers hope
We've definitely made the right decision. Good boy. We've got my boy back.
for families and their friends.
Look at you! Bionic doggo!
Yes, mate, I love you too.
At Fitzpatrick Referrals in the Surrey countryside, the day's patients are arriving for their appointments.
How you doing, guys?
Some are more enthusiastic than others.
Oh, that's so sweet.
He's a good boy, don't worry. Don't worry, Dexy.
Waiting for his turn is Dexter the Doberman.
He's a good boy.
He's been diagnosed with spinal problems and is returning to Fitzpatrick's for possible surgery.
He knew something was up as soon as we put his food in the car. He knew he was going somewhere.
Normally thinks he's going on holiday, and not today.
He's going to be all right, though, isn't it, boy? Hey?
7-year-old Dexter leads a comfortable life in Surrey with Virginia and her husband Vernon.
Dexter was one of 16. It was a pile. It was just a mound of Doberman puppies.
Dixie! Dixie dogs!
Dexter was originally called Shrek because he had sticky out ears, and he
yeah,
made
yeah.
a beeline for Ginny.
Yeah, he came over.
She said, I want that one.
They brought him home to meet Sky, their other much-loved Doberman.
She sort of viewed him as a bit of an interloper and wanted a shot of him. But she eventually came round to
He loved her,
tolerate
didn't
him.
Both dogs enjoyed an active life together.
Come on, this way.
But 2 months ago, Dexter started having difficulty walking.
We didn't know what, obviously, but we knew something was wrong.
And every time I touched him by his back legs went down and I thought it's not right.
Their local vet told them he suspected Dexter had a type of spinal cord compression in his neck known as wobblers.
We've noticed a sharp decline in him. He was limping, wasn't he? And his back paws are going, and you can hear him scraping. And that's not what life's supposed to be.
It's not the only thing the family have had to deal with. A month ago, Dexter's constant companion, Sky, had to be put to sleep, aged 12.
Since she's been gone, Dexter won't even bark. He won't come to see us. I don't know if he's lost, he misses her, or if he doesn't know what to do, or if he's in pain.
And all of a sudden his world's turned upside down.
Main thing I want for Dexter is to get him out of pain.
He deserves a good life. And if we can give him that opportunity, we'll go without a new kitchen and bathroom and everything else. He can have it.
Now, Dexter's mum and dad, hello.
Morning.
Hello, mate. How you doing? So
Dexter has already had MRI and CT scans of his spine.
Heel.
Today, the family are meeting Noel to talk about his options for surgery.
Who's who? You're Vernon, Virginia. See,
Georgia.
and you're related daughter. Very good. You're very stylish, ladies, and also very stylish face masks. Well done. Is the wobbling the same?
No, it's getting worse.
It's getting worse. We're just going to do a little walk so that I can look at his neurological reflexes. Come this way, please. So start there.
Right, heel.
Yeah, go.
What's this? Come on. Good boy.
Keep going.
Good boy.
Keep going. That's great. That's
Good
great.
boy.
Excellent. So what we're going to do next is we're going to do tests. Those tests are called conscious proprioception. His brain should tell his feet where to be. He's just farting.
I know. I was going to warn you. He's a proper trumpeter.
That's terrible, mate.
I already love him.
Right, brilliant. Go. Okay, so you can see that takes a while to come back.
Yeah.
That's too slow. All right, that's particularly bad. Unusual to have all 4 legs affected. Between here and here, there's a nerve running side by side.
Yeah.
Those nerves have a block of cement squishing on them here, and therefore they're shorting out. So that is why the dog's wobbling. That's called a myelopathy.
Oh, baby.
Sorry, mate.
All right, big boy. Come on, Dex, in we go. Good boy.
Okay.
Good boy.
Right. This is the MRI. The spinal cord is squished down by that disc bulging up. So that's the cement block.
Is that causing him pain?
Yes. The pain is caused by compression of the nerve roots, which are here and here. So those nerve roots come out and go to the front legs through those holes, right? And when I poked my finger in that, that's what caused the pain. You can see now that not only do we have a disc problem, but we have some new bone forming. And that new bone forming is also squishing the nerve root. We can see it's already black. Black is dried out. That disc shouldn't be black, that shouldn't be black, that shouldn't be black, that shouldn't be black. The bottom line is that most of the discs in that neck and in this part here, which is the thoracic spine, are diseased. And that's a genetic problem, so it just gets worse over time. I may not be able to address the degree of spinal cord damage that's already happened. So the only thing I have control over is how I decompress. Now, you and I spoke about this on the telephone, and we decided that we would have 2 options ready on the table. One was disc replacement and one was fusion. However, I'm concerned that if we fused 5, 6, and 6, 7, that it would stress concentrate into this segment, giving this a bigger bulk and bending against a smaller region and possibly flaring that disc up. Therefore, the surgical procedure that would potentially be preferable is an artificial disc replacement.
Our main objective is not in pain.
Sure.
The rest we can cope with.
Sure. Well, I think we can get him out of pain, and my objective is to get him through to the end of life. Then in the first 6 weeks, lead only walking on the harness, confinement to an area no bigger than 4 foot by 4 foot.
Is he allowed to go upstairs? To a shame he sleeps on our bed with us.
He won't be able to go into bed.
Right. Well,
He has to be in a confined
I'll
area.
sleep downstairs with him.
So I will ring you tonight. Let's go say goodbye to your friend.
Thank you
No
so
worries.
much for
Pleasure.
everything.
Pleasure, pleasure.
Dexter will have surgery later today, in the hope that it will get him back to his old self once more.
Please look after my boy. We've just lost one. I don't want to lose the other one. Thanks,
ya.
Noel.
Bye.
Thank you. What we didn't realise was he's had this since birth. That was a bit of a shock for us, wasn't it? Yeah. So we don't know what damage has actually been done. Time will tell.
I adore cats with their individual personality and their vastly independent minds.
Oi.
I actually quite like the cheeky cats that have that little bit of sass about them.
Sometimes they're difficult to win over, and when you have them and they like you, it's like, yes.
They're mischievous and they have all kinds of secret adventures.
Tiene du loco.
7-year-old feisty feline driver has arrived with serious hip and knee injuries. Maria has brought him in as an emergency on behalf of her mum.
He normally has cat fights with other cats in the neighborhood, but he never had something that serious.
Now, driver,
Hello?
nice to meet you. Hello, mate. Oh, gosh, one eye.
Yeah,
Just
that's
one eye.
an accident 3 years ago that he had. So.
Please go ahead into number 1 at the end.
Thank you.
Thanks. Okay, okay. Good boy.
He always gets himself
Now,
into
mister.
something.
Is he a pretty independent soul?
Completely.
Right,
Yeah.
so he goes out and about?
Yeah.
Hello, mate. How you doing? Good boy. Tell me what happened.
So my mom found him. She saw that his knee was not in a good place.
Right.
We called the vet and we took him there. We realized that it was actually a hit by a car.
Okay, fine. Let's have a look. Okay. Now, big guy. There we go. That's fine. You can just... Well done. He's a big cuddle monster, isn't he?
Yeah.
Okay. So the leg is weak, but he can feel it. Yes, he's got a right hip dislocation.
Okay.
Yeah. The bone is grating on the top of the socket there. Okay, that's fine. Now come the other side. Yeah, that's very sore, mate. I know, I'm sorry, matey. So he's got an unstable knee, and I can feel that the tibia is moving backwards and forwards, but importantly, and this is really important, is also moving sideways. Look at that.
Okay.
So there's, you hear that click?
Yeah.
That's a very, very badly damaged knee.
Okay.
The ligaments on the inside, on the outside, and inside the knee are all damaged. Okay, all right, big guy. Do you want me to proceed with diagnostics and get the CT now?
Yeah.
And I'll discuss further with you?
Okay.
Okay? All righty. Do a full pelvic limb workup and do a CT from the lumbosacral spine to the toes. Thank you.
Noel is concerned about the severity of driver's injuries. The CT scan will indicate what surgical options he can offer Maria.
Now, driver's mommy, please. Come on in. Grab a seat there for me, please. So, on this X-ray picture here, we can see the hip dislocation. So the hip has completely come out of the socket.
Yeah.
What I'm worried about is that, you see that piece of bone?
Yeah. So the socket is fractured or something?
Yes.
Okay.
And the CT scan is very specific, and it shows you that in fact there's loads of splinter fragments.
Oh,
in
okay,
here.
yeah.
This is serious trauma.
Okay.
And ultimately, Maria, we're going to need to make some big decisions. Sorry. Take your time. Take your time. It is serious trauma. Now, I'm not saying that it's not fixable.
Okay.
That's not what I'm saying.
Okay. If it's fixable, then we don't mind.
Okay.
Okay.
So the first option, if I can, is to repair it with a new ligament.
Okay.
So it depends on how much rim I've lost and whether or not there's enough socket to hold the head. That's the quickest and best option if I have enough anatomy.
Okay.
If I don't have enough anatomy, then you have to do either a femoral head and neck excision or a hip replacement. So femoral head and neck excision, you just chop the head off, leaving no joint. And that's done hundreds of times in the United Kingdom every week. There's always some degree of lameness, and it does not provide normal function. So the option 3 is a total hip replacement, which is where you put a new stem, a new head, a new ball, and a new socket. It tries to replicate normal anatomy.
Yeah.
Problem 2 is disruption of the knee. There's 5 ligaments in the knee, 2 of them are gone.
Okay.
So generally what happens is we do put a new ligament in from the front of the tibia to the back of the femur, and we use a synthetic suture material to do that. Now clearly that plus the hip is a massive undertaking, and I think your mother needs to be involved in the decision-making process. He's knocked out at the moment.
Okay.
We could convert that into a full general anesthetic and do the hip today.
Okay, yeah.
Go and ring your mom.
I'll ring her now,
Yeah, go
but
ring
I
her.
think we are prepared for that. So.
Go and ring her, and I'll go and see what my schedule is.
Okay,
Thank you.
Και θα δει αν μπορούν να κάνουν τώρα το μορφό. Μπορείς, κάνε από την άποψη ότι δεν είναι το θέμα και θα σου πω.
Driver, the feisty one-eyed cat, is in surgery after a car accident caused severe trauma to both his hip and knee.
Incision.
Noel will assess if it's possible to repair his damaged hip.
First of all, we have to figure out what's happening with the head and the socket.
Both the cartilage of the pelvic socket and femoral head need to be intact if Noel is to have any chance of saving the hip joint.
These little bits are fractured off the socket. It's not good. We can see here where the bottom part of the femoral head is worn away. Unfortunately, we will not be able to save this femoral head or socket. Okay, where's the implants, Kathy? Hand me implants.
With no prospect of a repair, Noel will now try to perform a complete hip replacement. But it's not going to be easy. He removes the damaged femoral head and the neck.
So we're now going to cement in the new cup. As you can see here, very tiny in my fingers. With a hip replacement, we don't have enough rim, so we're just going to have to be very careful that we put the cup in at the right angle. Now I'm applying significant pressure, pushing it into the cement against the bone.
The tiny cup must be at the correct angle, or the hip could dislocate. He then fills the femur with cement before putting the new stem in place. Key to the success of the new hip joint will be the muscles holding it in place.
The muscles have been torn by the dislocation, so we've got to be careful how we put this head back in.
Once the new head has been attached, Noel double-checks the joint is firmly in place.
As you can see, we can move it about, it stays in. So hopefully that will work. All right, let's go to X-ray, please.
Surgery over, driver must now stay confined, allowing the muscles to heal around the implants. Too much movement and the new hip risks dislocating. Staff at Fitzpatrick's know that the bigger the breed, the bigger the entrance.
There is something about them. They come into prep and they have this presence. You know they've arrived. They don't even need to do anything. They can just stand there and look majestic. And I think to work with their personalities is beautiful.
Having a big dog is certainly a challenge.
Be prepared to be sat on, trodden on, and slobbered on.
And it seems that opposites attract.
The families that have the bigger dogs always tend to be like the smallest person. It's really quite incredible to see.
Bailey, a 16-month-old Newfoundland, has arrived with his diminutive mum, Asmita. He's been suffering with pain affecting his right elbow.
I realised something was wrong probably around the end of May. He was really stiff when getting up, when going for a walk. It seemed really painful. He was limping quite a bit. His head was down when he was walking, which was unusual. It's been really difficult. He just really wants to run and play, and that's why he's talking to all the dogs. Bailey has always been a nutter. From the day we got him, he was very entertaining. When Bailey got to about 6 months, it started to get more difficult in terms of training because he just got so big so quickly and he can very easily overpower me. I live in central London and I live in an apartment. So the only concern having Bailey is if he does bark, it's a very loud, booming bark. But other than that, he's the perfect house guest.
But perfection comes at a price with a dog of Bailey's proportions.
I've had to make quite a few changes in my life for Bailey. Bailey's bed is huge, it's almost the same size as my bed. I did have to buy a car, a Bailey-proof, Bailey-sized car, because getting around in London with a Newfoundland is not that easy. Bus drivers aren't that happy taking him on.
Bailey may take up a lot of room, but for Asmita, he takes up even more space in her heart.
I've struggled with depression for a very long time, and I'd heard a lot about animals helping people with depression. I realized that a dog would be a great companion for me. He's given me so much support. Ever since I've got Bailey, it's just been so positive. He means the world to me. I can't imagine my life without him. Oh, sorry.
Bailey, yes?
Yes.
How are you?
Good, thank you.
Sorry about coronavirus.
Bailey has already had the lameness affecting his front right limb assessed.
Come on through.
Come on.
I know you saw my colleague Sarah.
Yes.
So this is a video that Sarah did. This is the inside of the right elbow. we can see that red is this red rubbing against that red. So it's like a brake disc rubbing on a brake pad. The ulnar support strut isn't fitting properly, and as a result, this part of the ulna rubs against this part of the humerus and fragments.
Okay.
And you get bone rubbing on bone. And there's a hole here.
Okay.
And that hole is formed by a condition called OCD.
Yes.
And it means that the cartilage, as it developed, it didn't convert into bone properly. And it got thicker, 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 and eventually broke off and cracked into the joint. Okay. So you got the double whammy.
So it's DED.
Correct.
Got you.
So you're very well researched. DED is developmental elbow disease. Used to be called elbow dysplasia. I helped to rename it.
Yes.
How do you know that?
I did my research.
Oh, you did? Wow, she's read my papers. You probably haven't even read my papers. So, yes. So what are we going to do to reduce the rubbing between there and there? My opinion is that you need a fairly dramatic unloading in a dog this size to get a sustainable benefit. You do that by cutting the humerus in half and shifting the load axis from the dog over towards the radial head, and thereby decreasing the load where it's rubbing. This standard plate doesn't work in a dog this size. We make a custom plate. So this is a healed version of exactly that. It's a big old plate, big dog, shift the weight over to here, and that's at 12 weeks.
Okay. Because he's still growing, how
Yes.
is that going to affect
No
his...
problem.
No problems.
Because we're not touching the growth plates.
Okay.
Anything else you need from me?
No.
Okay. What a pleasure to meet
Thank
you.
you. You too.
My most informed client for at least a couple of years. I can't remember anybody that came in as informed as you. Unbelievable. Look after yourself and we'll talk soon.
Come on, let's go.
Bailey will have to wait for his bespoke implant to be made. In the meantime, he's prescribed painkillers.
I'm looking forward to just getting him better. I want what's best for Bailey, whatever's going to work best long term and give us, a better quality of life for him, just so he can run around and be a puppy again. That's all I want. Yeah. There we go. Good job. It's my baby.
Dexter, the 7-year-old Doberman who's been collapsing on his back legs, is being prepared for his operation. The neurosurgery to relieve the pressure on his spinal cord is complex and has been approved by an ethics committee.
Right, let's go. Relax the hand.
Noel will operate from the underside of Dexter's neck.
Oh my God.
He will cut into and remove most of the 2 discs. He will then stretch the space between the vertebrae using pins on a distractor. The custom-made implants have 2 parts, a dome which moves against a dish. Both parts of the implant system will be anchored to the adjacent vertebrae using locking screws, before the procedure is then repeated for the other diseased disc. First, Noel needs to remove new bone that has grown around the discs.
The difficulty is knowing how much bone to take off, because that affects the fit of the disc.
He uses a distractor mounted on a pin in the vertebra on either side to pull them apart.
And I'm plucking out pieces of the disc that are pressing against the spinal cord. It's like a bump pushing up into the cord like so. And what I'm doing is trying to pull the bump away so the cord can straighten out like this and be decompressed.
Noel then inserts the implant system and secures it in place.
You've got to be super careful here because this disc is bulging up into the spinal canal, and at some point we're likely to get bleeding. There are venous sinuses down at the base of the spinal canal, and they can bleed down through this hole like a fountain bubbling up towards us.
The venous sinuses drain blood from the central nervous system. They're very thin-walled and often bleed when the disc material is extracted.
Give me a swab. There's an awful lot of blood in there. More light step. More, bigger, bigger.
Noel stems the bleeding quickly.
So that can be quite scary when it bleeds like that.
He then inserts the second disc and screws it to the vertebrae.
Those two discs are now mobile, which means that these vertebrae can move relative to each other down here. So now we stitch up. Let's go to CT, please, guys. Thank you. All right, buddy.
Dexter's family are waiting for news.
Hello, Noel.
I've done the op. It was difficult because obviously C07 had fibrosed for a very long time. But the post-operative images look fine, and now we're just going to have to see how Dexter responds to what I've done.
Right, okay.
Okay, guys?
Thank you very much.
All right, God bless. Bye-bye. Bye.
Now it's a waiting game to see if the implants will help address years of spinal cord compression.
Hello, mister.
When Driver arrived at Fitzpatrick 6 days ago, he was in a very serious condition, having damaged his hip on one side and the ligaments in his knee on the other. Noel performed a total hip replacement, but new X-ray pictures have revealed a problem.
Oh man, the hip replacement is dislocated. I suspect it's dislocated because the muscle is damaged and it's too loose to hold it in, and also there were fragments missing from the rim of the socket. Oh, nightmare.
Noel must now break the bad news to Maria and her mum Eleni.
Hello?
Hi Maria, it's Noel. Driver's okay in himself, but we do have problems, I'm afraid.
Okay, what happened?
He's tried to shuffle around, and because the muscle has not healed around his hip, the hip has come out of the joint.
Oh.
So we now have a dilemma, and that dilemma is, do you want me to try and fix the hip? I think I'm going to have to figure out a way to make a more robust repair by creating a roof for the socket. But it's not good that the head has come out. It means the muscle's really torn and really loose. Option 2 is chop off the neck and head of the femur, leaving him with no hip joint, but a femoral head and neck excision, which is a recognized technique, but obviously the femur will be like a piston going up and down because it won't have a firm anchorage. There are fallback positions, including full limb amputation or euthanasia.
Yeah, I'll just need to talk to my mom.
Yes, of course. So you talk to Mum, and then we'll reconvene in the morning. All right?
Yeah. Thank you very much. Thank you.
All right, God bless. Bye-bye.
Thank you, Bye.
There is no surgery without complications, and failure hits you hard, you know? Because you always think, well, could I have done something differently and got a better outcome? Who knows?
Feisty cat Driver has dislocated his hip while recovering at Fitzpatrick's, and his future is still uncertain. Noel rings Maria and her mother to discuss the situation.
Hello?
Hi, Maria, Noel here. Now, have you had a chance to talk to Eleni?
Yeah.
The question remains, short of putting him to sleep, whether you want me to try and keep the hip replacement or whether you want me to go straight for a femoral head and neck excision.
Can I ask, the hip replacement, how can it be fixed?
By either increasing the width of the cup, and if that wasn't enough, I would put a suture around the top of the femur into the pelvis.
Okay. I have a clear picture now in my mind.
Do I have your permission to proceed?
Yes.
Okay. We will do everything humanly possible.
Okay.
Okay, take care. Bye. Okay, here we go.
Driver's damaged knee also requires surgery, so Noel plans to repair that under the same anaesthetic after he's addressed the hip replacement.
We can see here where the muscle has been damaged. As well as tightening of that, I'm going to try and use a bigger cup in a more optimal position with a greater ledge over the new head of the hip, so there's less tendency to dislocate. So what we're going to do is we're going to make a little plate to put a roof on the socket so we can put a bigger cup in. And effectively it's like putting a lintel over a window.
With the plate in place, he fills the recess with cement, creating a strong rim, before putting in the new, bigger cup beneath.
Sometimes you have to bend the rules of mechanics to fit the biology.
And finally, he puts the new head on the stem.
Seems good. I'm going to stitch everything up.
Noel now moves on to Driver's knee, which has multiple ligament damage. He uses a guide wire in both the femur and tibia, along which he drills tunnels with a cannulated drill. He threads artificial ligaments through the bone tunnels, securing them with anchors on either end.
So that anchor just won't go through the hole.
Eventually leaving 4 strands of thread on the outside of the joint.
The ligaments are really badly stretched, so I'm going to have to do something else as well.
Noel decides to innovate, using the same technique in a way he's never tried before, and adds more ligaments on the opposite side in the hope that it will stop the femur slipping backwards on the tibia.
Pull this down. What I'm hoping is that one set of ligaments will pull against the other set and balance the knee. I've never actually used 2 crossover tightrope anchor systems in this fashion before. Feels stable.
Noel has done all he can.
We have a phrase which is called stable on the table, meaning that just because it's stable on the table when the patient is leaving the table doesn't mean it's going to stay stable. I think we're good to go.
Driver now faces weeks of cage rest, or he risks more complications.
How can he go to sleep so easily? Snoring.
Oh, that's really good, mate. All right, big guy. Good boy.
36 hours ago, Noel performed life-changing neurosurgery on Dexter, the Doberman.
Come on, mate. Well done, buddy.
And it's time to see how he's recovering.
Well done. That's great. Keep going ahead. Yeah, that's brilliant, mate. Well done. He's certainly better than I thought he would be at this stage. He's moving his neck very well. He doesn't seem to have any pain, but I just hope and pray that his improvement continues at this level, and we won't know for 3 months.
Wait.
Bailey, the 55-kilo Newfoundland, has had to wait for surgery while a custom implant has been made.
Wait, Bailey. Wait. You have to wait. There we go.
And it hasn't been easy for him, or his mum, Asmita.
Good job. Bailey's actually gotten worse since we were last year. He's been in more pain, more lameness on his front right leg, which has been really difficult because obviously I can't walk him as much. He can't play around. He gets really excited when he sees other dogs. Oh, sorry. Okay. He just wants to say hello.
It'll be fine.
He just wants to say hello to every single dog. Sorry. When he does get the zoomies, like, there's no holding him back. Like, he just has to say hello to everybody. Especially, like, we weigh the same, so that's quite difficult. That didn't go well. Hey, good job.
So pleased to be here.
Today's surgery will hopefully allow him pain-free zooming in the future.
Go this way.
All right, Bailey, all right.
There we go.
Go, this way, come on.
It's gonna be strange when I get home and he's not there. Hopefully I can get through the next 3 days.
So we're going to try and sort out Bailey's pain now.
Noel will be inserting Bailey's bespoke plate to help redistribute the weight in his right elbow. But first, he'll remove bone marrow from which stem cells will be extracted to help reduce inflammation in the elbow joint.
Just cutting down on the inside of the humerus bone now. There's a lot of blood vessels and nerves we don't want to damage.
Noel now inserts the stepped plate and secures it to the bone with temporary screws. Noel checks the plate is in the correct position.
It needs to be exactly halfway between the front and back of the bone where you're going to make the cut. We've locked the plate down onto the top part of the bone now.
Noel cuts the humerus in half, then moves and secures the bottom segment to the stepped section of the plate.
So as I tighten these screws, the bottom part of the bone comes up towards the plate.
Having secured the plate with permanent locking screws, Noel reinforces the structure with a second plate.
Bailey's 55 kilograms, so he's a big boy. And in theory, he could break this plate, even though this plate looks very thick. Because this plate is at right angles to that plate, it's very difficult for both plates to break.
He adds more screws and then bone graft at the step to help the bone to fuse in its new position.
So we can see the graft in place there now, where the step is. So we're going to have an S-shaped bone when that grows in.
Finally, he injects stem cells from the marrow harvested earlier.
Those cells, when injected into the joint, will hopefully reduce the inflammation and help to form a kind of scab of fibrous type of cartilage over the inside of the elbow that has been worn away. Okay, so we're all done. Let's go to X-ray. Thank you.
Bailey will need 12 weeks recovery if he's to get back to his old bouncy self.
Good boy.
Come on then, it's a good boy.
Just over a month ago, Dexter, the 7-year-old Doberman, had life-changing spinal surgery.
Right, wait.
But his recovery has not been without its challenges for Mum Virginia and Dad Vernon.
Gently. When he goes for a walk, we have to constantly hold him close to us. He's not allowed free rein. I think he's getting fed up, to be honest, because he's a dog that likes to get out and run. Come on. I can't read his mind, but if he was a human, I would say he was depressed.
More used to the run of the house, Dexter is now confined to the living room.
Dickie! Dex! He's a good boy. Since Dexter's been on restricted movement, I've had to move my office downstairs just to keep an eye on him. It's been a bit of a strain work-wise because I've had loads of calls to do and he gets a little bit agitated.
And with the marital bed out of bounds, Dexter has a new roommate downstairs to keep him company.
Night, love.
Sweet dreams.
Stay there. Sleeping on the sofa with Dexter, it has been a disruption. The worst night's sleep. However, I feel he needed some reassurance and company. We are following the rules to the letter of what Noel advised.
We've got to get it right, haven't we?
We've got to get it right. We get
right.
one chance at this because he can't ever have the operation again. Should he come through this, he gets a chance to start again.
After not one, but 2 surgeries to fix his hip and an operation on his knee, Maria has arrived, this time with Mum Eleni, to take Driver home.
Λένα δεν κολλάει, Λένα, γιατί. Άρα έχεις μεγάλη μύτη.
Μήπως χτυπά.
Now, you must be Eleni.
Yeah.
How are you, Eleni? Thank you so much for loving this pussycat as much as you do. He's a lovely boy.
He's
very cuddly.
he needs to be loved.
Yeah, he loves being loved.
Yeah.
He's been through an awful battle, and at the moment everything's working great. And I'm hopeful that as long as Driver behaves himself over the next 6 weeks, that will just settle down and heal. So any other questions for me before he comes in the room?
No, we don't. No, Borum. Yeah. Yeah, like, can we cuddle?
Yes, certainly he will love cuddles. Okay, yes, of course. Look who's here. Now. There we go. There we go. And cuddling him like that is fine.
Okay.
If I take him, if you put a harness on him, he can walk around your feet very gently. But really, for the next 2 weeks, I would prefer you just leave him in the cage, because I don't want him moving too much.
Okay.
Okay? There we go, mister. He's a fighter, isn't he?
Yeah, I think he wouldn't have survived otherwise.
He's a fighter, yeah? Okay?
Okay, thank you so much for everything, honestly.
My pleasure.
No, we're happy. He's good.
Okay,
He's
there we
well.
go. You okay? Thank you so much.
Bye-bye.
It will be weeks before Driver is allowed to get back to patrolling his neighbourhood, and Maria is not sure how well he'll adjust to a new regime.
He likes his freedom, so I think it will be a shock because he will be expecting to have the life he had before, and I don't know if that will be, he will be happy about when he realizes that, well, for the foreseeable future, it's not going to be that.
In southeast London, Bailey the Newfoundland is finally out and about after 3 months confinement.
He was really sad in the beginning, I think, you know, constrained to my bedroom and not being able to play with other dogs.
But following Noel's recovery rules has paid off.
He's much better. He's super strong, super boisterous. Obviously, we're still strengthening the leg. Not that way. And now that he can go to the park, run and play, he's super happy. It's like the best thing ever. Oh, really? Obviously, it's nice to have him get tired. He's a big group of doggies. Big group of doggies. When you find out that he has a condition like elbow dysplasia when he's so young, it's heartbreaking. Okay. And the decision to have surgery wasn't an easy one to make, but obviously I had faith in Fitzpatrick referrals and Noel, and I'm super, super pleased. I'm so happy that I decided to do it. Sorry. He's gonna be back to normal in no time. Come on. Okay, you wanna play? Let's go. Let's go. Come on, let's go play.
It's been 12 weeks since Driver had surgery to reconstruct his right hip and his left knee joint.
That was much calmer than I thought it was going to be.
For a feisty outdoor cat, he's even taken to the pool.
I was stressed that he might not like it and cause issues and problems, but apparently he has done well and he's a natural swimmer, so what I can say.
When Maria brought Driver in after he was hit by a car, she didn't hold out much hope.
We started from very bad news and prognosis, and now he's who he was. He's hiding. He likes to sleep in boxes that he finds randomly in the house. He even remembers places that we have forgotten he would go. After everything he has been through the last few months, I don't want him to go into any trouble again. So, because we almost lost him. So, both my mum and I were really happy to have him back, and especially my mum, because it's her little baby.
It's been 3 months since Dexter the Doberman had disc replacement implants to treat compression of the spinal cord. And Vernon and Virginia were concerned they'd never get the old Dexter back.
When Dexter was originally diagnosed with wobblers, he was a shell of himself. He couldn't walk properly, he was quite very subdued. Since Dexter's come back from Noel, he is a totally different dog. Go on, Dex, get the ball. He runs and runs, his tail's up.
He's got so much energy and he's just so happy all the time.
This is the Dexter of old we remember as a puppy.
We're really surprised and quite pleasantly pleased, aren't we? Maybe the nerves in the spinal cord wasn't as damaged as we thought they might be, and by relieving the pressure on them, hopefully it's relieved a lot of his movement.
Although this has been very trying at times, it's disrupted our life immensely, hasn't it? Would I do it again? In a heartbeat. The outcome of it far exceeded our expectations, and we are grateful to Noel for his expertise, and we couldn't ask for more. So pleased. More importantly, he's pleased. He's a proper dog, he's enjoying life, and that's what we're supposed to do.
Good boy. Good boy.